The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
Well, contact tracing is a tool used to slow the spread of the infectious disease or viruses like coronavirus. Contact tracers are kind of like detectives. They track down people who came in contact with an infected person, and then they backtrack. Mary Nichols explains what would happen if you got a call from a tracer.
When the pandemic started and we were seeing less and less patients, I was getting less and less hours, and so Intermountain made it a possibility to work with the Department of Health to start doing the contact tracing to supplement hours.
Healthcare workers across the state are being trained to help with coronavirus contact tracing.
And what we do is we reach out first to those people that were diagnosed positive with COVID-19. And we kind of try to assess the people they were in contact with prior to symptom onset. So for the 7 days prior.
Contact tracing is an important tool to slow the spread of the disease.
And you can imagine right there, if I stop those individuals from bouncing that virus around to others, spreading or transmission, then I can prevent, I can block the chain of transmission to others downstream and prevent an entire outbreak in a community.
If a contact tracer reaches out to you because you were in contact with someone who tested positive for coronavirus, they'll walk you through the steps you need to take.
You would try to determine the risk of exposure. So we would ask questions like, were you within 6 feet of them for 10 minutes or more? Were you in an indoor space? Are you a family member? Do you live in the same household?
Depending on the situation, you may be asked to self-quarantine and get tested.
And that may sound like, well, what's that going to mean if I prevent one transmission? Well, let's think about it. One person transmits to one or two others, and each of those transmits to one or two others.
Mary Nichols for Check Your Health.